Kumar. Thank you so much for taking some time to sit down with me today. I understand that you are the director of the Histiocytosis Center at Cincinnati Children's Hospital Medical Center in Cincinnati, Ohio, and you have been very instrumental in investigating the benefit and use of inhibitors with histiocytosis. And I understand this is also a huge focus of your practice. So there's two things we wanted to talk about today. And first being that I recently saw the release of the publication about novel therapy for Langerhans cell histiocytosis maintaining 100% response rate. And that was with an inhibitor called trametinib. And then I also understand that this may have been the catalyst of a clinical trial that's open for enrollment right now. So maybe you can share a little bit more about the recent release as well as the study.
Thank you, Deanna. Thank you so much for inviting me to join this conversation. And yes, several years ago, we started treating patients with inhibitors after their disease had progressed or recurred after having been treated with chemotherapy. And the initial responses were so dramatic and so great that they prompted us to start using these inhibitors more frequently, and to the point where I started questioning, why are we making children, or even adults for that matter, fail chemotherapy before we will offer them this novel therapy that seems to be at least as good as chemotherapy, if not better, and much easier to handle, especially for some of the children who don't have, which saves them from all the side effects. But most importantly for me was the ability to keep the disease under control, because we have seen several children who have now had to undergo liver transplant, or who have suffered significant irreversible consequences. And that led us to start using initially dabrafenib, which is a BRAF inhibitor, and then additionally trametinib, the MEK inhibitor. And so far, not a single patient has progressed on either of these therapies. And that was our recent publication. And you're right, that is what led us to then do a prospective clinical trial, which we are now ready. The trial is now open. And this is with a new MEK inhibitor called mirdametinib. And the medication mirdametinib, we're not the first ones using it, is already in clinical trials approved by the FDA for many other conditions. And it is almost identical in its efficacy to the other MEK inhibitors, with the advantage that it actually has the best ability to get into the central nervous system. And many histiocytic disorders do affect the brain. And so we hope that we will find that this prospective trial shows us that this drug is just as useful and tolerable as some of the other inhibitors that we have used. And since this will be a prospective trial, it will be a little more robust scientific demonstration of the efficacy and safety of this approach.
Wow, that's really encouraging and provides so much hope. I know that having good quality of life and also to understand how impactful and beneficial some therapies are can really make a difference for families. And it sounds like mirdametinib is a really exciting opportunity. And can you share a little bit more about how patients and families can enroll in this study, who might be eligible to participate?
Yeah, so the trial is open to all patients the age of 2 and above. For safety reasons, the FDA wants us to first focus on older individuals. When I say older, older than 2. 2 and older is all you need to be. And as long as they have a histiocytic disease for which treatment is indicated. Many children and adults with LCH may have a single lesion that does not need medical treatment. Those patients, of course, we would not treat, but anybody who needs systemic medical treatment, whether they are newly diagnosed or their disease has recurred after chemotherapy or progressed on chemotherapy, as long as they have measurable disease, they are at the age of 2 and older, and they're willing to participate in the trial. By that, at least for now, the trial is only open at Cincinnati Children's. They would have to travel, but we can facilitate that. These are the only criteria they need is a willingness to participate in the trial, and as long as they're older than 2 and need systemic treatment for histiocytosis, doesn't matter whether they're newly diagnosed or relapsed or recurrent, they will be eligible. And the way they can get the information is either going to the Histiocytosis Association's website, or clinicaltrials.gov, or our Cincinnati Children's website. They can email me. My email address is freely available on our website, or they can call our nurse care manager who coordinates all appointments for all histiocytosis patients. And Kristen Coleman is our nurse care manager, and her phone number is area code 513-636-9870. Through any of these means, people can reach out to us and see if they can enroll on the trial.
That's fantastic. And I'm very excited to hear that it's open for both pediatric and adult individuals. I know that is uncommon. A lot of times there are a trial that's available just for pediatric or just for adults. And so the fact that this is combined, I think also shows the promise in the efficacy and safety of this therapy. And, you know, while it's still 2 and above, 2 is still very young. So also, again, shows that promise. So that's really encouraging, exciting, and I think is going to provide a lot of benefit for families. And so we'll include information as well about the article that you recently released around trametinib and these inhibitors, and then as well also the link to the clinicaltrials.gov page. We'll have all that information available. Is there anything else you'd like to share with the Histio community?
Well, most importantly, thank you for popularizing and sharing this information. That is important. And I hope that people get hope from this, that we in the community of clinicians, scientists, and supporters like yourself and the organization, all we are striving to do is make the lives of people suffering from histiocytic disorders better. And it's not just using medication to treat them, but also making sure that they get to live productive, happy, fruitful lives, whatever it takes, that there is hope.
Thank you so much, and thank you for providing that hope as well through the work that you're doing at Cincinnati Children's and in all the ways that you support families. We appreciate you, and I appreciate you taking some time to talk a little bit more about this opportunity, and we're honored to be able to share this out with the community as well.
Thank you, Deanna.